Hi everyone, I'm Gary Knoll, and we're here to talk about health and nutrition, ways of improving the quality of your life. Now there are many ways of doing that. We can exercise, we can eat right, we can clean up our environment, our home, our workplace, our office, getting rid of many of the toxic chemicals. And of course we have to include our attitude. Now there's a whole new area of medicine and immunology and psychology that's focusing on how our thoughts, both positive and negative, can precipitate conditions positive and negative in our body. So we're going to focus on all these areas with our show. Each week I'll bring to your attention someone who I feel is making an important contribution to bring us that much closer to being well. Wellness is the key. By the way, don't go for that old adage that you have to act your age. Fastest way in the world to move one step closer to exiting this life. If anything, we should be denying this attitude that age and chronology are synonymous. You might be 50 years of age, but you might have a 20-year-old attitude towards life, and that's healthy. Then again, you might have a 90-year-old attitude, and that's not so healthy. So we're going to focus on that, and you'll hear about that and see it on upcoming programs. But today, what we're going to do is we're going to take a look at a very common problem, one that you've written about. And keep in mind, by the way, write to me in care of your local station. We're seen on almost 100 stations now, so whatever station you're watching, you write in care of Gary Knoll. They'll forward the mail on, and I personally answer all the mail. Well, in the past 6 months, the mail has gone heavily in the direction of getting over aches and pains. So I've invited back Dr. Howard Robbins. Dr. Robbins is an expert on musculoskeletal pain, adjustment, foot and leg care, and millions of Americans. It's estimated that 100 million Americans suffer from some form of back or foot or leg problem. And we're going to discuss that now. Welcome to the program, Howard.
Oh, thank you for having me, Gary.
Howard, I'd like to make it very specific because the mail was very specific. What do we do concerning the treatment of injuries, any kind of injuries that we can have, using either heat or cold, because people are confused. They don't know when to put something cold or hot on. They don't want to make a mistake. And how do you do it, and what conditions would you do it with?
Okay. Probably the most important thing to differentiate is when to use ice and when to use heat. I guess the first thing to understand is that for the first 24 hours to 48 hours following any injury in the body is going to react with a normal process. And this process, this inflammatory process as we call it, is going to cause swelling to take place. Now, if we were to use heat when something is swollen, we would open up blood vessels and lymph channels, and that would bring more fluid into an area that's already swelling up. That would cause more pain and more of a blockage. Thus, if you think about it logically, ice is the thing to use immediately following any injury. What ice will do is stop some of the lymph from flowing in, the water fluids from flowing in. It'll stop also the blood vessels. It'll close down the arteries. It'll stop more fluid from coming in, keeping swelling down and thus preventing pain. By keeping the swelling down with ice, we also can help circulatory change take place in a more natural way. You'll have a normal circulatory flow eventually taking place because, as you'll learn in a few minutes, we don't use ice constantly. Now, how do you apply ice? Well, everybody has some very sophisticated and unusual ice bags and ice packs they've made. They've used gel ice, for example, these refreezable packs that you can keep in your freezer at all times. Well, they have been known to freeze the skin actually lower than regular ice can do itself. Therefore, we're against using it, particularly in the elderly who may have very poor circulation to their skin in the first place. And if you freeze skin too much, then what's going to happen is you can get frostbite, and we can have other problems then. So ice is probably best used in the simplest and easiest of packaging, the old plastic sandwich bag, filled with just enough ice cubes to cover the area that you're involved with keeping cold. Just 2 or 3 ice cubes for a small area, or a half a dozen or so for a larger area is usually enough. And what you want to do is apply the ice in a very careful, very, very strict regimen of 10 minutes on and 10 minutes off. And this is constantly repeated until pain goes away. Following an acute injury, I recommend that the ice be used for as much as an hour and a half. Another interesting way to use ice is with ice massage. Now, you take a styrofoam coffee cup and you fill it up with water and you freeze it. Now you have a wonderful handle to use. You just sort of peel away a piece of the cup and rub it onto the area, and as you massage the area with ice, you'll find that a very interesting thing happens. The first couple of minutes, it burns and tingles. In fact, it can be even a little bit uncomfortable. The next 4 to 5, the fourth and the fifth, sixth minute, you'll find that the skin actually starts to ache a little bit and hurt a little bit. By the 9th minute, however, you'll find that it goes numb, so hang in there. And at the end of the 10th minute, you stop with the ice massage. The area should be well numbed out, the pain should stop, and a lot of the swelling should start to diminish. Never use ice massage for more than 10 minutes, and then wait 10 minutes before you re-massage with the ice pack again. Interestingly enough, you can always carry a plastic sandwich bag with one of those twist ties around with you, even in a pocket or in a purse. So you can actually have an instant ice pack wherever you go. And if you're out of the house and an injury occurs and you don't have an ice pack to make, there's always a can of soda to buy but not drink, or a can of beer that you can hold up against the injured part that might come out of a vending machine or someplace, or buy a cup of ice. Most places will be willing to sell you a cup of ice for just 20 or 30 cents. And you have that instant ice pack, that instant ability to keep swelling down.
But go over the conditions again, Howard, that would be best to use the ice.
All right. First, always use ice following an injury for the first 24 to 48 hours. Then, use ice whenever you're having pain. In fact, the rule to follow is, when in pain, use ice. Following injury, use ice. And if you're in doubt, use ice. Don't go to heat. Now, heat is used after the first 48 hours following an injury. Now the concept is the majority of the pain is gone. It may be sore and achy, but it's not acutely painful anymore. And what we want to do is get blood into this injured body part, because in the blood are all the nutrients and all the healing qualities that our body needs. So hot, wet towels is my first choice, perhaps another old remedy and another old way of treating something, but you can literally do this anywhere in the world then. You're not trapped by having to keep sophisticated equipment at home. Hydrocollator packs and all the new age ways of applying heat are wonderful, but they don't seem to do the job that the old-time hot, wet towel does. And all you simply do is take a kitchen towel or a hand towel, because it's of a size that can be easily wrung out, and just pour hot water on it right from the tap. Not so hot you'll scald yourself now. Wring it out well, and then wrap it around or lay it over the body part for about 10 to 15 minutes. Take it off and do it again. Even though it seems to cool down on the surface, the deep heating action is what we're really after, and that's what seems to be work very well from a hot, wet towel. There is an interesting way of using ice and heat together. In fact, we use it in a thing called contrast baths. What you do is this. Now, this usually takes place about a week or so, 4 to 5 days after an injury to a week after an injury, and you're still having a problem. Perhaps you've hurt your shoulder, your elbow, or your wrist, or your ankle. What you do is you fill up a bathtub with hot water, as hot as you can stand comfortably. And then right next to the bathtub, you put a bucket filled with ice water. And what you do is you put your injured body part into the ice water for 1 minute. And then it goes into the heat, the hot water, for 2 minutes. Then back to the cold for 1, then back to the hot water for 2 minutes. And what you're going to find out is, at the end of that last 2 minutes, what you've done is you've opened and closed your arteries so much that finally they stay wide open. Everything is going to be beet red. Lots of blood is going to be influxing, flowing into that injured area, and that's going to help break up swellings, congestions, and bring in a lot of nutrients to help that body part heal. And contrast baths, again, are one of the oldest remedies under the sun, but a wonderful way of using ice and heat together.
Now go over the conditions again that heat would help.
Heat will help after 48 hours following an injury. Remember, we want to keep blood flowing into an area to keep the injured part well bathed in nutrients and healing fluids. So when there's not a lot of pain, not a lot of swelling, 48 hours after that acute injury, go to heat. And the hot wet towel is probably the best. There's one injury I'd like to warn people about though, and when not to use ice or heat. And that has to do with head injuries. Now, if it's just a simple little bump on the head and you don't have any problems afterwards, meaning that you don't have double vision or blurred vision, you're not seeing little dots flying all around the place, you don't have headaches, there was no breaking of any skin on your head where there was bleeding, you don't have nauseousness, you don't feel dizzy, you don't feel suddenly weak or lightheaded after you stand up, you don't feel imbalanced. All those things are signs of a serious head injury. And we have to be certain that even in mild concussions, they're well taken care of at a hospital emergency room, just to make certain that it isn't anything more severe. There, if you're using ice or you're using heat, you may be using the wrong thing. So a concussion is the only warning that I want to make everyone aware of, to stay away from the ice and heat and get yourself over to a hospital right away.
Okay. What I'd like to do now, Howard, I'd like to have the audience focus in on the different conditions. Now, these are the conditions that you've written me about and that I promised that we would address on our next program. We're going to take a look at the most common conditions, everything from problems with the feet, like ingrown toenails and bunions and corns and calluses and hammer toes and flat-footedness and pigeon-toedness, all the different conditions that can unfortunately limit the quality of our physical being. So what I'd like for Howard Robbins to do now is to focus on the issues and what we can do to resolve them. So I hope you're getting your pencil and paper ready. Again, this is Dr. Howard Robbins. Howard, we went over the mail and you saw how many thousands of people are interested in feet and leg problems. So why don't we just go, so let's just start at the hip and go down the leg and feet, showing the kind of condition that can exist, how common it is, and what are the symptoms, and what we can do if we have that condition to overcome it without invasive medicine or surgery.
Okay. Well, we're going to start with the hip. What we're going to do is say that most people complain about two forms of hip pain. One form of hip pain is in the side of the hip, and that's truly deep in the hip, and let's just simply call it a form of bursitis. Now, there are certain areas of the body, the wrist, the elbow, the shoulder, the hip, the knee, the ankle, and a couple of other places, not to name them all, which I've just done, that actually have little sacs of tissue, like balloons, that can fill up with fluid. When they fill up with fluid, these burses, these sacs called burses, have a name. We call this condition bursitis. And the idea of filling up with fluid is to stop that joint from moving, to stop that part from irritating itself and making it worse. So by filling with fluid, this motion is stopped, and that's what bursitis is all about. Body doesn't realize it's causing itself more pain. So by reducing the inflammation of bursitis using the hot and the cold that we mentioned, that's the first thing. And then what we want to do is start the joint moving again. Now, this is key. If we can get a joint that's been injured moving, and I don't care if it's the hip joint, the knee joint, the ankle joint, the shoulder joint, just about any joint in the body moving again, that's the best way to break up the pain cycle and to get motion back in the joint, make the joint more comfortable again. If we let a joint stay tight for too long, it breaks down. That's when it's more likely to become arthritic eventually and just to stiffen up and become a chronic painful problem. So rotating our hips in circles gently would be one of the best ways to get that hip moving. To gently let the leg float in front of us, swing it forward and swing it back and swing it out to the side. That's a wonderful way to overcome a hip injury. And I think we once spoke about doing this in a swimming pool as a form of aqua exercise to take even more pressure off any joint. And that's a wonderful place to do these motions. While you're moving the hip, it would also help to use that ice massage. So rub that ice all over that injured hip and that'll help it. The second reason for hip pain usually comes from behind the hip, in the back. And then it's not really true hip pain. What we're almost always dealing with is a sciatica. And this is often caused by the pelvis being out of alignment and pressure being placed on one of the spinal nerves that comes and follows the path of the hip in the back. The pain usually runs down the thigh and very often into the foot and leg. Now, what usually is required here is chiropractic adjustment. Usually with osteopathic chiropractic adjustment of the pelvis, putting it back in alignment, most of these discomforts disappear. Often there's imbalances in the foot structure, and once they're rebalanced, that hip pain will go away too. Stretching exercises are essential. Most often people walk around with very tight hamstrings and buttock muscles. So by stretching those muscles out really well, we can help eliminate a lot of this pain. Next on down the line is the knee. And the knee tends to get the same kind of problems that the hip gets, bursitis. And this will happen from twistings and from poundings. If we jam our knee joint or twist our knee joint excessively, if improper movements take place, then the knee will become inflamed. And we have a lot of different conditions that can inflame the knee, but this is key. Probably 90% of all knee surgery is unnecessary in the United States. Probably 9 out of 10 knee surgeries could be saved with proper rebalancing of the body structure. That means that if you've had a serious knee injury, in many cases, you do not need surgery. Unless ligaments inside the knee have been seriously injured or the cartilage very severely torn, if you can live past the knee pain, you can rehabilitate your knee and almost always avoid surgery. Now, the way to rehabilitate the knee in almost every case is to stretch the rear leg muscles on a daily basis after gentle warm-up. Remember, stretching is not warming up the muscle. You have to warm it up first. Then, the strengthening of the muscles in front of the thigh, the anterior leg muscles called the quadriceps, that's also essential. And by rebalancing the stretching and the strengthening exercises around the knee becomes more stable. Then using the heat and the ice that we just previously talked about, you can heal 90% of all knee injuries. Now the ankle is next on down the line. The ankle joint is commonly sprained. Now, the way to heal an ankle sprain is very interesting. You have to actually cause motion in the ankle again. You have to rotate your ankle by hand, never just by twisting your foot, but only twisting your foot by hand gently, using ice massage while you do this on a daily basis, in the morning and in the evening. That, along with the stretching exercises for the muscles behind your calf, and most ankle injuries will be healed in anywhere from 2 to 4 weeks. If it's more severely sprained than the most severe ankle injuries, then it may require some professional care. A key thing to note is, are you aware of what your body structure is truly like? Often, a lot of these injuries are caused by imbalances in the back structure, in the hip structure, and in the foot structure. Now, in the foot structure, we can make inserts for your shoes called orthotic devices, and these orthotic devices can help prevent a lot of these ankle and knee injuries. As far as the back and the hip is concerned, by having a chiropractor or an osteopath rebalance your body, and by the way, I don't want to leave out anybody. Alexander Technique teachers teach you how to rebalance your body that way also. So do physiatrists, certain MDs that practice physical medicine, certain massage therapists, shiatsu people can also help realign the body structure back to normal in the upper body, and then exercises can help stabilize it. In the feet, all we have are the orthotic devices. The exercises are just the stretching ones that we spoke about. Now, moving on down past the ankle, we're into the metatarsal joints, and probably the most painful metatarsal joint that we have is the bunion joint. Now, people have that joint start hurting for many reasons, from gout to arthritis to jamming of the joint in athletic injuries, which is very common. And again, the best way to treat that, the first 24 to 48 hours is ice, followed by the heat treatments and gentle manipulation of the big toe up and down and around in circles to keep that joint freely moving. And that's key. And remember to ice massage whenever you move a joint, just to keep swelling and pain down. Now, an interesting thing, when a joint is injured and adhesion, scar tissue starts forming inside, we can't see this. That's why when we start to move a joint, past a limited gentle motion, it starts to hurt a little bit. And sometimes we even get a sudden pain, even weeks after an injury. Well, that's not necessarily bad. If we did it, cause this tearing of this scar tissue in a gentle way, an ice massage afterwards, you actually can get a healing of that tissue in a more natural, comfortable way. And once that tissue heals more naturally and comfortably, it's less likely to re-tear. Just a word about injury in general. Unfortunately, all injuries are permanent. And I don't want anybody to think that once they believe their injury is healed because the textbook says in 8 weeks a bone that's broken heals, and in 6 weeks muscles, tendons, and ligaments heal. It's not so. In fact, they've done some studies to show that even months later, while if you view these muscles, tendons, ligaments, and bones and take a look at them, they would say, wow, boy, the tissue looks fine, everything's healed, everything is perfect. But what they did was a study where they went down and viewed it on a microscope at the cellular level, and they found that the biochemistry of the cells was actually different in the injured tissue that looked perfectly well. So what we learned was that if the chemistry of the cells is different, they can't be exactly perfect. They can't be well. And all injuries, therefore, I tell my patients, are permanent. So always treat them with special respect and those injured parts with a lot of care and warm-up.
Now, what about the things such as hammer toes, ingrown toenails, and fungus under the toenails?
Wow. Okay. Well, hammer toes are a very interesting problem. In fact, I just had a patient in today with a hammer toe, and she was complaining of a pain from a corn that she had there. And what I finally made her understand after convincing her that x-rays weren't necessary to see what I see all the time is that there was a bump developing on the bone, and that the bone actually became irritated, and the flesh between the skin and the bone became irritated. And that's what was actually hurting her toe, not the thickened dead skin that was growing up there. And by trimming it down, something that chiropodists and podiatrists have been doing for many years, was not the long-term answer to helping her problem. After all, I told her she could go home and just wet her skin and use a pumice stone on it herself to help keep that under control. The key was in straightening the toe out. By itself, the toe wouldn't straighten. What she needed was something that would raise her metatarsal bone, which had dropped down. And when her metatarsal, like the metacarpal in my hand, drops down, notice my fingers must rise up. Then my fingers bend as the tendons contract. In fact, in hammer toes, you'll see very contracted tendons on the top of the foot. And these contracted tendons are what's causing the flexible hammer toe. Now, if I could raise those metatarsals up, the toes would straighten out. And that's the way to control this problem. By making an insert for a shoe that would raise those metatarsals up, those hammer toes will straighten. And I have to say that in 10 years that I've been doing radio and TV with you, Gary, I would say that I must have saved now somewhere in the neighborhood of about 8,000 to 10,000 toes from hammer toe surgery. It's an amazing number. It sounds like a lot, but remember, everybody has 10 toes, so it's not so hard to save at least 8 per person. And 8,000 to 10,000 may be a very conservative number, considering I used to do anywhere from 2 to 4 hammer toe surgeries per foot, per person, and I used to do 4 to 5 surgeries per day, 5 days a week. That's a heavy-duty surgical load for just one doctor. And imagine there's 10,000 men in the country practicing podiatry, plus 100,000 orthopedic surgeons, where there's got to be at least 10,000 more doing foot surgery every day. So there are ways to save foot surgery, and don't just run in and have that operation just because the man suggests it. Now, ingrown toenails are another problem. Here's where heat and ice don't necessarily help right away. But something that you can do immediately to reduce the inflammation from an ingrown toenail is to take a little bit of cotton with a round toothpick and gently pry a little bit of that cotton underneath the tip of the ingrown toenail. That'll lift the edge, the corner edge up, and that very often takes away the pressure. If the toe seems a little red and inflamed, wrap it in gauze, all right, and then pour on a solution made from a pint of boiled water and a teaspoon of sea salt. Let the solution cool down and pour a little bit on that gauze so the gauze gets very wet. Then let the gauze evaporate dry. When it's bone dry, it'll take a few hours. Wet it again. Now keep this going, and this acts like an old-time poultice, and it actually will draw out any infections and inflammations or bring them to a head and give you a chance to seek more professional care.
Tea tree oil is also a good healing agent, topical agent. Have you heard of it?
Tea tree oil is very good. In fact, you can use a number of different things. I like to make a healing solution up for these herbal poultices of comfrey leaves, golden seal root, and peppermint leaves. And these have natural antifungal, antibacterial, and mildly astringent properties when mixed with about a quart of solution. About a half an ounce of each of these leaves, you make a nice tea up out of it all and strain it out well.
Good. Now, just to summarize, Howard, if we're talking about any kind of foot injury, what is the best way of approaching who to go to so that you don't end up with an unnecessary surgery?
Okay.
Or unnecessary x-rays?
Well, this is a very difficult thing, and I have to be honest, 90%, we were told in our profession that if you don't x-ray 90% of your new patients, you don't have a very successful practice, so I guess I'm doing very poorly because maybe less than 10% of our practice gets x-rayed. So, generally speaking, most men don't need the x-rays they like to take on you, and it's very hard to get away from that. Try and find a podiatrist, a foot specialist, if it's a foot and lower leg injury, that will actually work with you about that. And if you're getting well with more conservative measures, you don't really need x-raying then. Be amenable to an x-ray if there's an acute injury, and that and only then.
Thank you very much. Dr. Howard Robbins, my guest. I'm Gary Null. We'll be back next week. Until then, stay healthy and stay well.